Little bumps on your neck, your armpits, your back, those tiny skin tags that seem to appear out of nowhere. And even though they don't hurt, bother you more than you'd like to admit. They make you pull your collar up, avoid wearing sleeveless shirts, and feel self-conscious. Every time someone notices them, how many times have you searched online for how to get rid of them and found 1,000 different remedies, all promising results in just a few days? How many times did you try something that didn't work, or worse, left your skin irritated, or with a mark that looked even worse than before? The question so many people ask is this: can they really disappear with something I do at home? The short answer is yes. But the honest answer is that the real solution is much simpler, much safer, and completely different from everything circulating online. Today, I'm going to reveal exactly what those bumps are, why they show up on your skin, and there's something here that very few doctors actually explain about what's going on inside your body, and most importantly, what you can safely do to get rid of them once and for all. Stay until the end, because what I'm about to share will completely change the way you look at your skin. I'm Dr. Ramon Valenzuela, and I've been practicing medicine for over 20 years. In all that time, if there's one thing I've seen repeat itself over and over again in my office, it's the frustration in my patients' eyes, especially in people over 40, who come in exhausted from fighting these little marks on their skin. They've tried everything, they've spent money on remedies that don't work. And in the worst cases, they've put their health at serious risk with methods they found on social media or in online forums. Today I'm going to share with you the same step-by-step protocol I walk every single one of those patients through when they come in with this concern. This is not a magic solution. I'm not going to promise you these disappear overnight. And we are not going to talk about dangerous home remedies that can leave you with a scar or an infection. What we're going to do is understand what you actually have on your skin, why it shows up, and how you can take action in a smart and safe way. So if you're ready to stop hiding your neck or your underarms and want the peace of mind that comes with healthy skin, stay with me. Before rushing to find a solution, the most important first step is to pause and ask yourself a very simple question that almost nobody thinks to ask. Is what I have on my skin actually what I think it is? In my experience, the vast majority of patients who come in worried about warts actually have something completely different. And that confusion is exactly the root cause of almost every failure when people try to treat themselves at home. Let's clear this up because your skin is always trying to tell you something. You just need to learn how to read it. There are mainly two types of skin lesions that people confuse all the time: true warts and skin tags, also known as acrocordons or papillomas. Think of them as distant cousins. They look similar at first glance, but underneath they have nothing to do with each other. Let's start with true warts. A wart is the result of a viral infection. The culprit is a very common virus called the human papillomavirus, or HPV. There are over 200 types of this virus, and the majority are completely harmless, only causing these skin lesions. Most of us have been exposed to it at some point in our lives. It spreads through direct contact, skin to skin, or through surfaces like the floor of a public shower or a shared towel. It spreads through direct contact, skin to skin, or through surfaces like the floor of a public shower or a shared towel. The virus is an opportunist. It takes advantage of small cuts or scratches to enter the outermost layer of the skin. And once inside, it sends one clear message to your cells: multiply. That uncontrolled multiplication is what forms the lesion we call a wart. How do you recognize one? They tend to be firm, hard, and rough to the touch, almost like a tiny cauliflower. If you look closely, you can sometimes see tiny black dots inside. A lot of people think those are roots, but they're actually small clotted blood vessels. They appear most often on the hands and fingers, but also on the knees, or the soles of the feet, where we call them plantar warts, and they can be quite painful when you walk. And here's the key word: warts, being caused by a virus, are contagious. They can spread to other parts of your own body, or be passed to other people. Now let's talk about the star of most of the confusion, the acrocordon or skin tag. These are the little flesh-colored bumps that appear very frequently on the neck, armpits, groin, under the breasts, or on the eyelids. They affect a huge portion of the adult population, practically half of all people over 50. And here is the fundamental difference. Skin tags are not caused by a virus. I'll say it again, they have nothing to do with HPV and therefore are not contagious. You can't pass them to anyone and nobody gave them to you. A skin tag is simply a small benign growth of your own skin, made up of collagen fibers and blood vessels wrapped in a thin layer of skin. Visually, they're different. Unlike a wart, which is hard and rough, a skin tag is usually soft. It moves around and hangs from the skin by a tiny stalk, almost like a little pouch. Its color can match your skin tone exactly or be slightly darker. So if it's not a virus, what causes them? Science points to two main factors. The first is obvious: friction. It's no coincidence that they show up in the folds of the body, the neck where a shirt collar rubs, the armpits, the groin, areas where skin constantly rubs against itself or against clothing. But there's a second internal factor that is far more revealing, and that I consider essential for my patients to understand. The widespread appearance of skin tags is strongly linked to your metabolic health, specifically to insulin resistance. Let me break that down simply. Insulin is the hormone that acts like a key, allowing sugar from the blood to enter your cells and be used as energy. When we spend years eating large amounts of sugar and refined carbohydrates, our cells can gradually become deaf to that signal. To compensate, the pancreas produces more and more insulin, creating an excess in the bloodstream. So what does that have to do with your skin? Insulin is also a growth-promoting hormone. Those elevated levels in the blood can signal skin cells to multiply more than normal, which is what forms skin tags. That's why they're so commonly seen in people who are overweight, have metabolic syndrome, or have type 2 diabetes. So in many cases, those little bumps aren't just a cosmetic issue, they're a small warning signal. Your skin is sending you about what's happening inside your body. To wrap up this section, there are two other lesions worth knowing about. The first is seborrheic keratosis, sometimes mistakenly called age warts. They are not warts and they are not viral. They tend to look like brown or black waxy patches that appear stuck on top of the skin. Keep in mind, they are not dangerous. The second is the mole. If a mole you've had for years starts changing in shape, color, or size, or if a new one appears with an unusual look, bleeds, or itches, that should never be ignored. That is a sign to see a dermatologist without hesitation. To summarize, if the lesion is hard, rough, and located on your hands or feet, it's likely a viral wart. If it's soft, hangs from a tiny stalk, and sits on your neck, armpits, or groin, it's most likely a skin tag. Understanding this difference is the single most important step toward the right solution. Because treating a skin tag like a wart is not only useless, as we're about to see, it can actually be dangerous. Many home remedies for skin tags are a real risk to your health. The most popular one is tying them off with thread. The first major risk is infection in a non-sterile environment. You're strangling living tissue and creating an open wound. Bacteria can cause cellulitis, producing intense redness and pain. The second risk is bleeding and permanent, noticeable scarring. The process of tissue death is messy and often unsterile. The third and most serious risk is misdiagnosis. Certain skin cancers can look just like harmless bumps. If you remove it yourself, a doctor cannot analyze it. You could be destroying a critical medical warning sign. Always see a professional physician for any skin changes. The second group of dangerous methods is attempting to cut the lesion at home with scissors, razors, or nail clippers. Here, the risks escalate even further. The danger of serious bleeding is very high because these growths have their own blood supply. Wiping a pair of scissors with rubbing alcohol is not even close to the same thing as professional surgical sterilization done in a clinic, so the risk of infection remains enormous. I remember one patient who, out of embarrassment, tried to cut several bothersome skin tags by himself from his underarm with nail clippers. He ended up in the emergency room because of the bleeding, the pain, and an infection that required intensive treatment. The unfortunate result was permanent and visible scarring, and a frightening experience he won't forget soon. The third method I strongly advise against is using uncontrolled acids on your skin. Online you will find many dangerous recommendations to apply apple cider vinegar, concentrated lemon juice, or similar substances, applying these substances directly onto the sensitive lesion. The problem is that these acids don't discriminate. They burn the skin tag and the healthy skin surrounding it, causing chemical burns, severe irritation, and once again, permanent scarring. I completely understand that the temptation to act is real. Finding a quick and cheap fix is a very real temptation. These lesions are frustrating and hard to ignore, and they can deeply affect your self-confidence, and you want them gone now. But my professional responsibility as a physician is to put your safety above everything else. The risks of these methods far outweigh any possible benefit. An infection or a scar is too high a price to pay. For avoiding one medical appointment, the right path is not the fastest one, it's the safest one. And that's exactly what we're going to talk about right now. Alright, we've covered what these lesions are, and, most importantly, what you should never do. Now we finally get to the this of the title, the method that actually works and is safe to follow. But I want to make one thing crystal clear from the start. This is not a magic formula or a miracle cream. It's a protocol built on knowledge, safety, and patience. It has 3 steps: identification, controlled action, and knowing your limits. Step 1 is safe identification at home. Before touching any lesion, we're going to do a little detective work on your own skin. This does not replace seeing a doctor, but it gives you valuable information to act intelligently. Ask yourself these 5 questions. First, where is it located? If it's in a fold of the body, like the neck, armpits, or groin, that points to a skin tag. If it's on your hands or fingers, or the soles of your feet, it's more likely a viral wart. Second, what does it feel like? If it's soft and hangs from a small stalk, that suggests a skin tag. If it's hard and flat at its base and rough to the touch, that points to a wart. Third, what color is it? If it matches your skin tone or is a uniform brown, that's typical of a skin tag. If it has tiny black dots inside, that's characteristic of warts. Important note, if the lesion has multiple colors, is very dark, or has irregular edges, stop right there. That is a red flag, and means you need to see a doctor. Fourth, has it changed? If it's grown quickly or changed in shape, changed in color, or bleeds without any clear reason. Any rapid change is a reason for an immediate appointment, no exceptions. Fifth, do you have any underlying medical conditions? If you have diabetes or poor circulation, or a compromised immune system, your risk of infection is higher, and your ability to heal is lower. In those cases, the recommendation is always to avoid doing anything at home and go directly to a specialist. If after this self-examination everything points to a small and stable skin tag or to a common wart, and you are otherwise healthy, then and only then can you move on to the next step. Step 2 is controlled action at home. Here the paths diverge because the treatment for a wart is completely different from the approach for a skin tag. For common warts on the hands and feet, the safest and most science-backed method for home treatment is low-concentration salicylic acid. It's available without a prescription at any pharmacy in the form of a liquid, gel, or adhesive pads. It works by slowly dissolving the layers of the wart. The absolute key is patience and following the process precisely, because it can take several weeks or even months. Here is the exact nightly routine. Soak the affected area in warm water for 5 to 10 minutes to thoroughly soften the skin. Then dry it well and using a disposable nail file, and I want to emphasize disposable because you should never reuse it. Gently file the surface of the wart just enough to remove the dead skin on top. You're not trying to make it bleed, just remove that outermost layer. Throw the file away after each use. Now here's the step that almost nobody does, and that makes all the difference. Using a small amount of petroleum jelly, protect all the healthy skin surrounding the wart. Create a barrier so the acid only touches the lesion and doesn't irritate the skin around it. Then apply a small amount of the salicylic acid product directly onto the wart, cover it with a bandage or a small piece of medical tape, and leave it on overnight. In the morning, remove the bandage and wash the area thoroughly. Repeat this process every single night without skipping days. Consistency is what gets results. If the surrounding skin becomes red or irritated, pause the treatment for 2 or 3 days and then resume. For skin tags, the approach is completely different, and this is where the real secret I promised at the beginning finally comes in. The this of the title is not any product or cream, it is understanding the root of the problem from the inside out. The most powerful method for dealing with skin tags has 2 sides. The first is internal management. If you remember what we discussed earlier about insulin resistance, you already understand that the origin of these growths village in what you eat, often lies in what you eat and how you live. The real strategy to stop new ones from forming is to adjust your lifestyle. Dramatically reduce your intake of sugars and refined carbohydrates. White bread, white rice, soda, candy, processed snacks. All of those foods are essentially the fuel that feeds skin tags. Increase your fiber intake through vegetables, legumes, and whole grains. Move your body more regularly because exercise helps your muscles use blood sugar efficiently. and directly improves insulin sensitivity. Manage your stress levels and prioritize good sleep, because both of those factors also play a significant role in your hormonal and metabolic balance. This approach will not make the skin tags you already have fall off overnight, but it is the only real and lasting strategy to stop new ones from appearing, and along the way, it will improve your overall health significantly. The second side is external management of the ones you already have. If there are small skin tags that are bothering you, and you want them removed, the fastest, safest, and most effective option will always be a simple 5-minute procedure at a dermatologist's office. It's a straightforward visit, very accessible, and it spares you every single risk we talked about earlier. Some patients ask about tea tree oil for skin tags, but being completely honest with you, the scientific evidence behind it is very weak, and it can irritate sensitive skin. It's simply not worth the risk when you have better options available. Step 3 is recognizing your limits. Self-treatment has clear boundaries and you need to respect them. You should stop and see a dermatologist without hesitation. If the lesion is on your face, genitals, or any sensitive area of the body, if it bleeds, hurts, itches, or is changing in appearance quickly, if you have a large number of lesions appearing at the same time, if you have diabetes, poor circulation, or a compromised immune system, and if after 2 to 3 months of consistent and disciplined wart treatment, you see no improvement whatsoever, the method I have shared with you today is not a trick. It's a philosophy. Know your skin, act with care, and respect your limits. That is the real secret. And with that, we've come full circle. We started with that very common frustration of not understanding what those bumps are or what to do about them, and we've arrived at a place of genuine clarity and real control over your own skin. Today you learned how to tell the difference between a viral wart and a skin tag, and you understood that skin tags are often a signal from your body about what's happening on the inside, something that genuinely deserves your attention. You learned why you will never again reach for a piece of thread, a pair of scissors, or an uncontrolled acid for these lesions. And above all, you now have a clear, safe, and practical protocol to take action with confidence. My goal today was never to hand you a magic recipe. It was to give you something far more valuable, the power to make good decisions about your own health, so that the next time you notice a lesion on your skin, you don't feel fear, you feel the confidence of knowing exactly what it is and what to do about it. The true health of your skin is not about perfection. It's about being informed, being patient, and making the right choices. If this video gave you the clarity you were looking for, the best way to support this work is by joining this health-conscious community. Subscribe to the channel and turn on notifications because every week I share practical, science-based tips explained in plain language, straight from a doctor to you. And now I'd love to hear from you. Leave me a comment below. Did you already know the difference between these two lesions? Have you ever tried a home remedy for them? Your experiences help all of us learn. Thank you so much for being here. Take care of yourself, take care of your skin, and always remember, the best decision you can make for your health is an informed one. See you next time.